was the hardest day of business when I had to furlough my entire team. And quite honestly, we had one of the best years that we've had. I don't manage out of fear anymore.
Welcome to Healthcare Business Growth Conversations. Today, we are joined by Dr. Ashley Spooner, founder of Dynamic Dental Sleep, creator of Sleep, Thrive, Live, and one of only a few hundred dentists in the States who hold Diplomate status from the American Board of Dental Sleep Medicine. So, Dr. Spooner, when I looked at your profile, the one thing that caught my attention was the sleep, because I was not expecting a dentist focusing more on sleep than on anything else. You said dentists should be more than tooth mechanics. So that's the angle that I really liked. So that's the reason that I invited to this show. So Dr. Spooner, welcome to the show.
Thank you. Excited to be here.
Awesome. So I just want to start with the same thing. You have used the phrase, not just a tooth mechanic. So what does that actually mean, if you can explain that to our users?
Yes, so it actually comes from my background. My dad actually was a mechanic. He owned a Volvo repair business for years. And so that's a piece of the puzzle of where that phrase came from. But truly, it comes down to that dentists previously were known as someone, your tooth is broken, we fix it, we put a crown on it, we may do a filling, there may be a cavity, things that really are just an objective item that we do. And this has really changed over the years. In the 15 years I've been practicing, we're correlating medical histories, we're correlating inflammation, and we're gearing our treatments more so to be preventative versus reactive. So no longer are we just those tooth mechanics. We truly are a oral healthcare specialist, and we're a provider who is a part of the medical care team to really help our patients be healthier overall.
Got it. So let's say a patient who has the OSA, at what point they should consider seeing a dentist rather than a pulmonologist or an ENT?
Absolutely. So very interestingly enough, the stats is that about 97% of patients rely on a non-specialist to be able to help them with a sleep disorder. The fact is that we're short by about 46,000 specialists per Americans. And so there's a great shortage of specialists to be able to be seen. And that's where us as dentists, we look at airway all day long. We take CBCT, 3D x-rays. We're doing our oral cancer screenings and identifying tongue position, where the pharyngeal space is with the tonsils and the soft palate. We can ask more questions when we notice that somebody clenches and grinds or may have recession and abfraction. All of these things can be signs that there could be obstructive sleep apnea occurring. That, combined with a great medical history review, can really help to start that screening process for patients so that then we can help to refer to get them screened and diagnosed for sleep apnea.
Wow, that is really insightful for most of the people like us, even me from a non-medical background, that, for an OSA, how dentistry is related. So what are the common misconceptions about sleep medicine in dentistry that you would most want to correct?
Absolutely. So where the dentist comes into play is we are able to provide, a trained dentist is able to provide an oral appliance to treat obstructive sleep apnea. An oral appliance is something that helps to support the lower jaw in a more forward position, which helps to prevent the obstruction from happening while they're sleeping at night. The misconception is that oral appliances are expensive and they don't work. And that actually is not true at all. They are very effective. A lot of patients are concerned about potential side effects. And when done correctly and when we do the proper intake prior to the appliance itself, we're really able to really manage side effects and also avoid many of those side effects that you may hear about. Compliance is also a big thing, and adherence is a big thing. Yes, CPAP has always been the gold standard to treat obstructive sleep apnea, as well as other sleep-related breathing disorders. However, many patients are not compliant with it. Only about 30% of patients at 6 months are still compliant with their CPAP, whereas 94% of patients with an oral appliance remain compliant after 6 months. And so this is something that we can utilize that is great even if we need to use co-therapy in more severe situations, but is very effective, and our patients are much more adherent, which leads to managing this disease long-term and having better outcome.
Perfect. So, just from the business point of view, at what point you have seen the potential on the sleep side in the dentistry?
Absolutely. This is something that I started approximately 10 years ago. And then it was very early. And everybody thought, quite honestly, that I was crazy of this is never going to go anywhere. What are you thinking? Just stick to what you know, stick to bread and butter dentistry. And really, it is something that the dentists look at every single day. We see these patients. We're able to spend more time with our patients. On average, we see a patient every 3 to 6 months, and we spend a minimum an hour with them when they're there for an exam and a cleaning. And so this is a place where we can have these conversations with patients. And we know that there's 1 billion adults in the world that are affected by obstructive sleep apnea. And the current statistic is 86 to 95% patients in the United States are still undiagnosed. Every dentist on every corner and every physician could be screening and diagnosing and treating, and we still wouldn't hit to where we could be 100% treated. And so this is something that all of us can be doing. It is great value add to the practice of bringing in additional referrals from medical providers, but also you're truly helping the patients. And when you have better outcomes, patients trust you, they start to refer other patients, and it's truly a practice builder as well.
Got it. So interestingly, you mentioned physicians here. So do you see physicians and dentists struggle to work together in sleep medicine?
It's definitely something that medical and dental has existed in silos for many years. And the reason that happened years and years ago of just how they separated out medical and dental. For many years, the head was cut off from the rest of the body and the mouth was not connected to the rest of the body in the medical field. Now, with all of the stats that we have, we know that that's not true. And we know that 80% of what goes on in your body starts in your mouth. The mouth is the gateway to your health. And so sleep is a piece of that puzzle. With physicians, it's the difficult piece of the puzzle is that we're all busy and it's hard to determine what is the best way to communicate. In my office, we send letters. I will send progress notes. I will send everything that I can to help to ensure that we're collaborating on the care of this patient. I know what my role is, but also the physician has a large role in that. And that could be a general physician, that could be the cardiologist, the ENT, it could be an OB/GYN, the sleep specialist. All of us working together is what's going to achieve the best outcomes for our patients and also help our patients to continue to be compliant and adherent with treatment that's going to help them.
Got it. So one thing I found interesting is that most clinicians stop at the practice level, but you created Sleep, Thrive, Live. Like, why build a brand outside the practice? Isn't it more work for you? I'm talking from the business point of view, creating two different brands requires more efforts than one brand.
When I started all of this, and of course I started as a practicing general dentist, I still practice general dentistry, and that's what I do in Highlands Ranch, Colorado. But that was something that to provide additional care for patients and to be able to do that, education is also a big piece of the puzzle, and sleep is still relatively new. And what I found was first I approached dentists and I wanted to help to educate dentists on how they could be screening and obtaining diagnoses in their practices. But then I realized that if the patients don't know about it and we start talking to them about it, then we need to create an awareness and in a way that they can understand, in a way that can be accepted, and honestly, in a way that's fun. And so Sleep, Thrive, Live is that. It is truly a educational public arm that helps us to just educate and get the word out there, get these stats out there about things like 75% of diabetic patients have obstructive sleep apnea. 50% of patients with hypertension have obstructive sleep apnea. They may not know it. We also know that obstructive sleep apnea is one of the number one causative factors for high blood pressure. There are so many more stats, including AFib. We can reduce AFib by over 90% when we treat obstructive sleep apnea. And so all of these things, if you start educating patients on this, now all of a sudden those patients are going to be asking their provider. They're going to ask for additional screening. They want to be healthier. We're in a world today where we as a society, we're looking for those answers. We're looking for regenerative medicine and preventative care. People understand now they don't have to live inflamed and tired and in pain and just feeling crappy. And so this is a great way for people to understand what questions to ask And then that also helps to drive the providers to, you really have to learn more when your patients start asking you these questions. And then that's how we can continue to help the patient.
Yeah, patients always ask you more questions about these things. Because honestly, even as I said, even I couldn't think of going to a dentist for OSA. So do you have any moment or a story that you remember, where it clicked in your mind that you have to launch this Sleep, Thrive, and Live?
Yes, it clicked when I started talking about with other colleagues, and colleagues are on board with this and they see it. Implementation is difficult. It's when you already have something that's working well, you have great seamless workflows, your team is on board, they're educated in what you're doing. It's difficult to come back and say, hey, I want to start to implement something new. And we know, especially us as providers, we go out to a continuing education course and we get excited about something and we come back to the office on Monday and we say, hey guys, this is what we want to do. And they just roll their eyes. Oh, great. What is that going to take me to do? And so the piece of that was, how do I help them to implement? And by doing Sleep, Thrive, Live, this is providing just another resource of where patients are now coming in more accepting to hear this conversation. That's step one, is overcoming the barrier of being able to have the conversation with the patient and having them be receptive. Once you can get over that barrier, and now you're starting to do this consistently, I teach every patient, every exam, we should be having these conversations, then now it's easy to start to implement the workflows that I also teach through Dynamic Dental Sleep.
Yeah. So if you're starting the brand, again, the Sleep, Thrive, Live, the education part today from the scratch, would you do it anything different than what you have done?
So interestingly enough, a lot of this is because I do run my own dental practice. I have a large group practice. And so Dynamic Dental Sleep as well as Sleep, Thrive, Live, these are what I call my side jobs at this point in time. And so with that, I've learned a lot. I've actually enjoyed that. I've had a lot of fun with that. The others may think that that's crazy, but this is just something where I've run my business this way. I've learned this way of, I like to learn things from scratch and I like to know how to do them because that helps me to then teach others down the road. And so while that's been a lot of work and it's taken time to do so, I think learning how to do these things on my own has now gotten me, number one, more clear on what my mission is and what that vision is and how everything works together. And so by doing so and working that way, now I'm able to incorporate others to be able to help me on a marketing side and on my website, on educational design, these types of things. But I had to be really clear on what I wanted first. And so that would be something for anybody who's trying to start something like this. I think that's a big piece of the puzzle. You can, number one, waste a lot of money trying to figure that out if you don't know that from the get-go. But also having that rollout of a clear brand, a clear mission helps you to stay on track. You can easily start to get sidetracked and go down some rabbit holes that maybe aren't necessarily headed towards your real end goal. And so especially doing something like I do, running 3 separate entities, you have to be efficient in that to be able to have the time to do that. But also having it all work together and all feed each other, that's the ultimate mission in what I'm doing. And so that helps to keep me on track to do so.
Yeah, so you called it a side gig, and then these are the 3 entities that you're working on. I just wanted to know a little bit more about it, like the practice side, the education company, and then the public-facing brand. Now, how do these 3 entities/businesses support each other?
Absolutely. So, of course, my practice is where I see patients. I also have associate dentists, I have specialists, I have a large team. And so that in itself is the ultimate patient care. The other areas of Dynamic Dental Sleep is education for providers and their teams on dental sleep medicine and how to do that effectively. I've also created specific workflows that support what I teach. And so really it's a one-stop shop. It's an easy system to be able to implement. The piece of that is practicing and being in the trenches that way, understanding where the bottlenecks are when I am in practice. That has helped me to design workflows very specific for that dentist who is trying to implement this into specifically a general dentistry practice. By doing so and by educating, not only does that just fulfill my desire to be a good mentor, and it gives me a way to help even more people than I could on my own, but it also helps these practices now to continue to grow and spread that message. In my mind, this is a way to cast a net that is able to capture more and more patients. Like I mentioned, this is an 86 to 95% undiagnosed disease. And so there's so many patients out there for us to help. I am able to help more people by educating and by helping them to be able to implement into their practice. Then we tie that in with Sleep Thrive Live, and Sleep Thrive Live it's truly fun. I never thought that I would be one on social media and making videos and doing all of these things, but doing it in a way that makes education, number one, fun, but also makes this information attainable and accessible to anyone, and in a way that they can understand, and that it really it hits home. It's every piece of that puzzle affects someone. And I do that both for the providers, but I also do it for patients. And when patients are now equipped with these types of questions, now that just feeds that entire loop again. They're going back to the dental office, they're asking the questions, the dentist is implementing, and now it all comes full circle to be able to achieve that greater mission.
Well, it's a lot that you're doing. So how does your typical week looks like?
Well, I preach that we should sleep. I probably don't sleep enough.
Yeah, that is the exact reason. I just wanted to know how does your week looks like, because I was just genuinely curious about how you're handling three different brands at the same time.
Yes, it's very true. So, what my week looks like is I work 6-hour shifts with patients. And so I work late on Mondays. I work from 1 to 7. On Tuesdays, I work 11 to 5, and then 7 to 1 on Wednesday and Thursday with patients. I very intentionally, when I'm in my office, I am a provider. And so I do separate those things. I don't bring in the other projects that I'm working on to the office. I am there. I am a leader in the office as the owner, as well as a mentor for my entire team. And so ensuring that that stays separate, that I'm focused and that I'm present for my patients and providing the best care possible. So those hours, that's what I do. Of course, there's admin time that comes into just owning a dental business, a dental practice. So handling that during those times as well. My days are long. I can absolutely spend 12 to 14 hours a day at my office. So even though I only see patients for 6 hours, there's plenty of other things to be doing. After that, then typically I have admin days on Fridays. So I'll work a lot for Dynamic Dental Sleep and Sleep Thrive Live, create content, start scheduling my publishing. It's great now that, AI is an amazing tool when used appropriately. And so there's a lot of automations that help me a lot to be efficient in that. So I do leverage tools like that. I leverage scheduling tools for social media and just utilizing that information. I also have a bunch of listservs that helps me stay in tune to what's going on in the industry. And so helps me to get a snapshot, and then I can dive deeper into the things that are pertinent to, again, staying on track with what my mission is. So they're long weeks, but it's very rewarding. And I think it's something when you have a true purpose and you truly value what you're doing and you're excited about it, it's no longer work. And so it is something that I enjoy. I, of course, still enjoy things with my family and getting out. I'm very active, love to ski, love to bike, all of that. So everything I do, I think my personality is pretty intense. I'm all in with all of it. And so it just makes it fun.
Yeah, no, you nailed it. The purpose is the key. You have the purpose, you're able to manage your time and then manage all the brands. And then you said you are the leader and the mentor while you are at your practice. So I just want to know any leadership lesson that you have learned managing teams that surprised you.
Yes. Oh my gosh. Leadership evolves every day. And I think that's a big piece of the puzzle is you never have it nailed. Just when you think you've got it, there's something else that comes. And gosh, I would use COVID as a major example of that. During COVID in the state of Colorado, we were able to provide dental care that was emergency dental care. I still had a large team, and it was the hardest day of business when I had to furlough my entire team. And it was scary. We didn't know if we were going to come out of that. We didn't know if the business was going to exist. And really my attitude through all of that was I was responsible for all these people's jobs, and I needed to make sure they had a place to come back to. And so that changed a lot of just how I managed things and being able to get through that. And quite honestly, we had one of the best years that we've had. And so it worked. And having that attitude, leading by example of, hey, even when things are hard, we can make it happen. We can pivot. We can be innovative. there's many things we can do. And so I use that experience a lot now. What I would say too is I don't manage out of fear anymore. I'm not afraid of a conflict. I'm not afraid if somebody's leaving. I'm not afraid of change. There's a reason that all of those things are happening, and it's all in how you handle it. And so I think that's, as I've matured in that type of leadership and more so taken approaches of seeking to understand, whether that's from a patient or an employee or a process that needs to change, that has really helped to create a culture in my office that I'm very, very proud of.
That's really insightful. Whenever you are no more afraid of change, I think that's when you can do a lot of things that actually make an impact.
Mm-hmm.
So on the same line, delegation is much more important, as a leader. So, and a lot of clinicians struggle to let go and delegate. How did you make the transition?
I think delegation is extremely important. Delegation also will start to stimulate even more trust in each other, trust in team members, and trust in patients. Having delegation, I run a very busy practice. I see a lot of people at once, and there's no way I could do that if it was just myself. I have a extremely strong team. They're very talented. They're extensions of me. And I think when, as a leader, you can do that and you can be comfortable in that and trust in the team that's there to support you, number one, it creates a lot of loyalty. And number two, now everybody is able to do more and they're able to make extensions of themselves. And now all of a sudden, we talk about that broader net that I'm trying to cast. Now I'm able to do that and I'm able to make something that's much bigger than me. I can say I didn't start that way. I wanted to control everything and I wouldn't change that because I learned a lot that way too. I learned every aspect of the job, and I think that helped me to also then let go of it because I could teach it and I could discuss, hey, these were my pitfalls. This is where I struggled with this. What do you think? How could we improve this workflow? And now incorporating everyone to be able to do that, it just allows for more growth, again, more innovation. You can start to bring in more things and really hone in on what your niche is because you have more people to support you to do so.
Perfect. So on the same note, I believe you have made mistakes as a leader and also as a business owner. Now, what are the few things that you can recollect that taught you the best things in the business?
Teaching me the best things in the business, I would say, are you create great personal relationships with the people you work with, as well as with patients in my situation. And sometimes when you start to have a great personal relationship with someone, sometimes that can cloud judgment in other things. And so it is important to, as a business owner, as a leader, to be able to separate that. And what I mean by that is absolutely still having those close relationships and that trust, but at the same time, knowing when you have to have some crucial conversations, knowing when at the end of the day, you're either the boss, you're the provider, you're the one that person is coming to, and you need to step up to the plate. And so I would say I learned from experiences where I maybe let an employee situation go on too long, and that affected other employees. And it also really looked poorly on my reputation of if I'm saying one thing, but I'm allowing another. And it looks like favoritism, or the patient's my friend. And so I don't want to tell them they have something wrong. And then that's not ultimately helping them either. And so really seeing that, understanding that, and knowing that business is business and you can separate that piece of the puzzle and just being able to establish that type of relationship with the people that you work with.
Got it. So let's look ahead a little. I just want to know your opinion on how dentistry will look different from 5 years from now.
Yes. Oh my gosh, it's evolving every day. The technology that we have, salivary diagnostics, sleep studies, wearables, so many things. We can make crowns in our offices. We can place implants same day. There's just so much that we can do, and it's exciting. It's really exciting. It's such a great time to be in dentistry, and I would just say that it's always going to be changing. So don't be afraid of that change and dive in. Really focusing on the oral systemic link this is where this is going. We're headed towards medical dental integration. And if we as providers are not on that path now and not learning and not establishing the workflows to support that, we're going to be behind. We need to do that. And so that would be my biggest advice to anyone out there who is in the dental profession is continue to learn about chronic inflammation, learn about inflammatory factors, learn about saliva science. All of these things are going to be contributing factors to how we care for our patients in a more predictive versus reactive way. And that's what our culture is going to want, as well as that's where medical dental integration is going.
Got it. So, what opportunities do you think younger dentists are overlooking today?
I would say that there are opportunities, of course, sleep, number one. This is something that, again, every single patient that walks into your office every single day, with how many patients are undiagnosed, this is something that you could easily implement starting Monday. And being able to do so, whether you choose to treat the patient with oral appliance therapy or not, you're still helping. You're still establishing referral sources. You're still growing your business and overlooking the oral systemic link, diagnosing periodontal disease, making sure that we are predictive in that and not monitoring disease. That used to be something that was just, we were taught wait till something breaks, wait till the cavity's bigger, wait till the gum disease is severe. And now that philosophy is much different. The science supports it, that the sooner we intervene, the more predictive we're able to be, and the more conservative we're able to be in the long run.
All right. So, just if a dentist is graduating tomorrow and then wanted to build an extraordinary career, what would you tell them to focus on?
First and foremost, focus on your connection with your patient. When we go in, especially coming straight out of school, we go in and we're guns a-blazing. We want to tell everybody everything that we know and everything that we learned. And many times that just leaves a patient a deer in headlights. And so making sure to take the first 3 to 5 minutes of your interaction with your patient and just get to know your patient. Why are they there? What do they like to do for fun? What's their family life like? Where do they live? Where do they work? All of these things come into play as to what are their goals. Ultimately, when we are able to sit and listen and connect with our patient, that's how we're able to help them achieve what they came for, but also how we're able to build the trust to be able to discuss all of those other things that we've learned in school.
Perfect. So, is there anything else that you want to tell to our listeners that I haven't asked you?
I just say stay tuned. There's so many things coming. It's exciting. Innovation is out there. And so this is something that I'm on top of. So follow Sleep, Thrive, Live. Take a look at dynamicdentalsleep.com. There's great information, a lot of free information to just stay on top of not only the dental industry, but sleep specifically, and what we can be doing as providers, but also for patients, how you can ask the questions, how you can be an advocate for yourself. And ultimately, all of us can be healthier, have a better quality of life, and just enjoy our longevity for years to come.
Perfect. So, where can our listeners actually know more about your work? Can you just give the website or social handles?
Yeah, so at Sleep Thrive Live is on Instagram as well as YouTube. And then dynamicdentalsleep.com is a great resource. There are both patient and provider resources there, as well as the different courses that I provide. But always stay tuned on LinkedIn and everywhere else where I have many publications, podcasts, videos, presentations at different conferences as well. So I'm everywhere. So stay tuned.
Yeah, this is great. Dr. Spooner, thank you for joining us today. I think the biggest takeaway today is that the healthcare professionals who see beyond procedures and focus on overall patient outcomes have a tremendous opportunity to build meaningful businesses and also impact more lives. Once again, thank you for joining us on Healthcare Business Growth Conversations.